Goeiedag, good day, fellow South Africans and citizens of the world. And wow, what a mess in the public hospital system. Well, we aren't surprised, are we? We've been talking about it for months now. But let me give you the latest update. The situation in which South Africa finds itself as regards the shortage of medical equipment is approaching a critical point. Now remember, this is before the coronavirus actually really hit South Africa. The Parliamentary Portfolio Committee on Health has already requested the Minister of Health, Zweli Mkhize, to urgently investigate these shortages. Well, we know why there's the shortages, because of looting, corruption, backhanders, you name it. It happens in every single ANC department, at all levels of government. At present, South Africa only has a mere 6,000 ventilators available. And this is a kicker. Just 2,000 of those are in the public health sector. Only 2,000 in the public health sector. You'll probably find about half of them don't work. So you're looking at probably, 700 to 800 that you could actually possibly use for someone who's really sick with the coronavirus, based on past records. Concerning the shortage of intensive care beds, there are presently a total of only 7,195 beds available in both the private and public health care sectors. The shortage of ventilators can be ascribed to the fact that there is currently a worldwide problem, particularly because healthcare systems usually operate based on the typical need and only a small degree of additional capacity. The Freedom Front Plus truly hopes that these problems are considered top priority by the National Department of Health. The shortage of masks and other protective clothing for doctors in hospitals and clinics must also be at the top of the priority list for the department and the Ministry of Health. If doctors and other healthcare workers are not provided with the protection they need, South Africa will face an enormous crisis that will put additional pressure on the healthcare system. Well, it's collapsed, let's face it. Over the years, the public healthcare sector has been invested in the manufacturing and procurement of critical medical equipment. The demand for ventilators is already exceeding the supply, and thus methods to give preference to the patients who need it the most will have to be considered at some stage. The criteria for admission to intensive care units will have to be very transparent and must be determined in cooperation with the Critical Care Society of Southern Africa. In order to do this, a panel consisting of leading experts must be established. Such a panel must consist of at least one specialist in critical care, a medical ethics expert, and a legal aid expert with a very strong background in medicine. South Africa's population is currently about 60 million people, and according to all indications, more than 60% of the population will be infected with the coronavirus at one stage or another. An estimate of approximately 36 million people. So why the heck are we in lockdown? I don't get it. It's just all it's doing is destroying the economy of South Africa. And 4% of these people will need ventilators. That adds up to approximately 1.44 million people. And they've only got 6,000 in the whole system. Great. And we don't even know if all those work. Evenly distributed over a period of a year, it comes down to approximately 12,000 people per month. It is thus abundantly clear that the crisis South Africa and the rest of the world are headed towards is becoming increasingly serious. According to published media reports, a country like America already has a shortage of about 30,000 ventilators. In this context, worldwide communication channels between governments, medical experts, engineers, and the like must be established as soon as possible to combat the crisis. Well, I'm not surprised in South Africa there's a shortage. This ANC government, well, I don't need to say any more. Please remember to subscribe to be kept informed. Ring the bell for the updates. Please like this video. Please share this video. Above all, please stay safe. Bye for now.